need to know that it may also affect the face and the hands, while the edema of the heart usually affects the lower limbs, and the edema of the liver usually affect the abdomen. Is it clear? So those are the different things that you must put in mind. So after the fluid, the next thing is that fluid overload. You can have acidosis. Is it clear? So on physical examination or history, how can you evaluate for acidosis? Acidosis can vary with acute breathing, which is a deep and rapid breathing. Is it clear? You can have acute breathing, and you need to know that what you have mnemonics for acute breathing, which is acute that I've already explained in diabetic mellitus tutorial. I'm not going to explain it here again. Now, so after the acute breathing, so you have acidosis, you can have acute breathing, you can have also a colic abdominal pain with vomiting, which can tell you that there is acidosis. The third element after that, in acute kidney injury, for the complication, you can also have for the complication you need to know that what you can also have hyperkalemia. Is it clear? Hyperkalemia in acute kidney injury. You can have hyperkalemia here in acute kidney injury just because so you can have also hyperkalemia, and hyperkalemia is going to present with irregular. You can have when you have irregular heart rates. Is it clear? It can be a hallmark sign for hyperkalemia. Is it clear? When you have irregular heart rate and also the patient is also becoming tired. Is it clear? Body weakness. Is it clear? So those are associated with hyperkalemia. Now we have in addition, so these are the complication of acute kidney injury. Is it clear? So we need to know that in addition to these complications, we have now the complication of chronic kidney disease. The chronic kidney disease has this complication plus other ones, like the first one is anemia. Is it clear? So anemia can occur also in chronic kidney disease. Is it clear? It's a complication of chronic kidney disease. The second complication is that you can have hypocalcemia. Is it clear? Because you need to know that anemia is because you need to know that erythropoietin is normally produced by the interstitium of the kidney, which is not going to be produced again in a case where you have a chronic kidney disease, the destruction of the interstitium. You have hypocalcemia in chronic kidney disease. Why? There's two reasons under. The first reason is that in chronic kidney disease there is no endocrine response there's no endocrine response to the hormones. Like when you are going to have parathormone normally is what causes is going to bind at the level of the kidney for the reabsorption of calcium. So since there is no endocrine response against of the kidney because of the damage, you're going to have hypocalcemia and hyperphosphatemia, which is going to later on result to an osteodystrophy. Is going to later on result to an osteodystrophy and multiple fractures. The third element after this, after the hypocalcemia and the hypermagnesemia, you are also going to have you can have so those are the different elements. Is it clear? And in addition to that, you have what is the renal failure. Renal failure is just when the kidney fails. Is it clear? And in renal failure, the major element of the renal failure is going to be uremia. And uremia presents as two things. It presents as uremic syndrome, and it also presents as a uremic encephalopathy. Is it clear? Uremic syndrome can be just vomiting. When the patient has vomiting, when the patient becomes confused, when the patient has vomiting, the patient becomes somnolent, the patient has a uremic breath. So those are elements for uremia. Is it clear? But now, in case of uremic syndrome, it's much more associated with the elements of the 3C. You have confusion, you have convulsion, and you have coma. Is it clear? And then on physical examination, in patient that has uremic syndrome, you ask them to extend their fingers. And when they extend their fingers, you are going to visualize hysteresis. Is it clear? And hysteresis is the same as flapping tremors. Is it clear? That is for renal failure. So those are the different complications that you can have in renal failure. So we start for only acute kidney injury, we have fluid overload, acidosis, hyperkalemia. In addition, fluid overload, acidosis, and hyperkalemia. In addition to that, you have uremic symptoms like uremic syndrome and uremic encephalopathy that can occur in acute kidney injury. Now, in chronic kidney disease, we have all the complications in acute kidney injury plus anemia, plus hypocalcemia, plus even hypertension, provided that it is affecting the glomerulus. Is it clear? Even in acute kidney injuries plus hypertension, provided it's affecting the glomerulus. Is it clear? So those are the different elements, and then in addition to that, you have the elements of renal failure, which are uremic syndrome and uremic encephalopathy. Basically, so now after seeing the clinical presentation of renal failure, we are now going to continue with the diagnosis of renal failure.